Hey everybody, Luke Gordon here, and today I was working with a client who is actually preparing for total knee replacement surgery. She's having it in about a month or so, and I'm helping her with her knees going into surgery, especially one of them is really hard to straighten right now, and I'm also helping her with her back because she's got scoliosis and some other things. So we're kind of working on two things at once with the idea of getting her in the best shape that she can be. And so she asked me a question that I've actually gotten several times on YouTube that I thought I was trying to make a video about, which is, will using an inversion table help me straighten my knee out? And up until now, I really haven't thought about it too much. Again, I get questions once in a while, but I decided to try it with this client because we talked about the inversion table kind of more for like her mid and lower back pain, but we also thought, well, hey, you've got this knee, and her knee is like, it's not straightening very well. It's like a good 30 degrees to get to zero, to completely straight. And so I said, well, why don't we try it out? And so I put her on the inversion table twice now, and it works really well, actually. Her knee is straightening out a little bit. It's really arthritic, so it's kind of hard to straighten out before surgery, but it's working out. It helps with her back, and it helps with her knee. And what I found today was, after having her on the inversion table for 5 or 10 minutes, and then I bring her back into the treatment room, it was a lot easier for me to stretch her knee into strengthening, and it wasn't nearly as painful. So as near as I can tell, basically doing the inversion table was just giving her a little bit of space between those two joint surfaces. And so, you know, giving it a little bit of slack there. And then when I would go back into the room and lay her on her back, and usually what I do is I put like a towel roll underneath her heel, and then I'm pushing down on her knee, which was actually pretty springy today, which is great. You don't want like a hard feel. You want more of like a loose or like an elastic feel. And I said, hey, does that hurt? Because usually folks are like jumping off the table if you're trying to straighten their knee like that. But anyhow, she says, no, it doesn't really hurt that much at all. So I thought it was very encouraging, and I just thought I would just jump out here on the side of the building and make a quick video because I've really never tried it, and it had really good results with this gal. So I think if you're considering using an inversion table to help straighten out your knee, I think it's definitely worth a shot, and especially if you have back pain too, which a lot of folks do, especially if you're walking on a bad knee for months to years. I think it's worth a shot. So if you have questions about if an inversion table is safe or not, you know, you can run that through your therapist. I've got some other videos on inversion tables, which I'll probably link here at the end, and just to show you some guidelines for an inversion table and how to use it and stuff like that. But anyhow, I thought it was a good message to share. One more tip, one more tool in your tool bag if you're struggling to get your knee straight before surgery, after surgery, even if you're not having surgery, you just have a really stiff knee, I think the inversion table is definitely worth trying. So that's the message for today. One more tip, like I said, is straighten your knee. Hope you liked it. Watch these other videos if you need more information on inversion tables, and please like and subscribe before you go. Leave me a comment if you're feeling generous. Thanks for watching.